I feel like by the end of this, if I have mine running, it'll be a great gag reel.
You want to turn yours on?
I don't care.
Okay. So find out what your injury is.
Mm-hmm.
Do your best to train around it.
Yes.
Help.
That's kind of the main thing of it, really.
And make sure that you're not kidding yourself about what you're really capable of doing.
Mm-hmm. That's more, that's like
And
the
then
limits
I
one, yeah.
put this smart-ass answer of Louis C.K. You should go watch Louis C.K.'s on YouTube about turning 40, because that was my smart-ass answer. And I said, Spencer, I'm almost 42 years old and you're giving me the 25-year-old answer because you don't know what I'm talking about yet. And that's really true. Like, you really in your body don't know what I'm talking about yet.
Of course not. I'm not a woman, for one.
You're not a woman. And probably, I mean, I know that all athletes deal with injury and struggling like that, but as somebody who, like, I've been doing fitnessy things since I was 13. And I've gone through phases where I was really out of shape, neglected my body. I weighed 200 pounds at one point, not pregnant.
Well, it's normal to have those ups and downs.
Right. This was a big down.
Right.
And I've also been really fit and really strong. And, but now as I'm getting older, and I like to be strong. Like, I really enjoy being strong, and I enjoy the process of working out, but I like to be strong. And I feel like it helps keep me youthful. But what I've discovered as I'm aging is that, like, there are all kinds of things that I would like to do. Like, but I can't do it. Like, my body is just like, yeah, you're not, no. And one of the things I said to you is when your knees and your hips and your shoulders are all hurting you,
what can you do?
You can't, like, even though my muscles could do a lot of things, my joints won't allow it. Like, it's very hard to be cardiovascularly fit when all the joints of your lower body don't let you move, because this is your large muscle groups.
Right,
exactly. If I can't move them, I can't get stronger, and I can't make my heart pump as well. Even swimming, like shoulders, it's just a mess. It's a mess. So, and then I find that, because it used to be as a young person, all I had to do is go, now I'm changing my mind. I'm deciding I want to be fit now. And you just go choose something you want to do, and you go do it. And the biggest hurdle that you have to overcome is making up your mind. But now I've made up my mind, for the most part, that I want to be fit, but you have to become this creative and very particular, like, you can't just go, I'm just going to go for a run. I don't get to just go for a run.
Right.
It becomes this ordeal, which means it becomes way more difficult, which means sometimes you don't do it because it requires, like, more thinking, more planning, more care. And then you lose momentum, and then before you know it, you're eating donuts on the couch every night. It's terrible.
Right. And so what we see there with that, and it's the kind of thing, every person's going to have their own kind of situation, because now yours is like an inflammatory kind of thing. Yeah. I know that it was osteoarthritis.
Yeah, I have osteoarthritis in my knees. My hips getting funky now. My rotator cuffs are kind of going like I'm just a mess. Yeah. I'm a mess.
It's
terrible.
But here's the thing, because there's two sides to this. Now, I remember in your response, you've gone through and you've talked about this is what my body is doing to me, but you've also acknowledged that your diet could be a lot better. There could be a lot more paying attention to that. So here's the other side of it. This is where the other side of it, because we have these issues, but if we're not doing as much as we could be to fix them, there's the balance, and everybody's got their own.
Right.
So it's not. I'm not sitting here saying like, oh, you just gotta like work harder and stuff. I'm not that naive, but it's the kind of thing. It could be better, and it's just the kind of thing.
Absolutely.
Find what you. If there's something you really want to do, try to find some way to do it. Try to find some kind of way. If you really want to run, I mean,
I don't.
You could try. Okay.
I don't really want to run.
Okay. So but let's say if you did.
Wait. Let me make sure it's still going.
I
thought I heard something. Okay, no, we're good.
We're good? Awesome. Yeah, they make noise over there, so. If you wanted that, I would say, well, maybe can you walk on a treadmill at an incline? should be. Still not, fun, right? But
I
but
only
it
want to
loses
dance
something.
for cardio.
Okay. And
That's
so dance,
fucking hard on your knees.
yeah, so the dance, it depends on what type of movements. I would have to know what kind of dance it is to be able to kind of assess what the biomechanics of it are. It's the kind of thing, I'm glad you're doing yoga. That's fantastic, because yoga is something that can give you, not like a workout, but it's good. It's still kind of
it's pretty
well,
hard.
if it's
So
tough yoga,
depending
if it's
on-
tough yoga, if it's hot
Yeah.
yoga, if it's that kind of stuff, it really gets you going for sure. But it's one that is going to be a lot lower impact, that kind of thing, and at least lets you do something. And then the mental benefits are so good as well.
They are.
So in every individual case, you kind of have to see, you know, and that's where I'm going when I'm saying know what your limits are, because a lot of times people will I get so many guys, they walk in, not saying you do this, but there are guys that walk into GNC and they say, well, I'm 40 now, so I need to do this and this. They just assume it comes with the territory. And
Because they're 40, that they can't do this, and
well,
this?
they'll use like whatever age, or they'll say like, oh, I'm almost 50, so I probably should start taking some of these joint care things and stuff. They don't necessarily like need it. They just think they should
No,
because
I'm
now their
saying
age
it
has gotten
because
to a
my
certain-
joints
I believe
really
you.
are fine.
No, I totally believe you. But I'm just saying I see a lot of times people will sometimes get out of control with it. Sometimes, in some cases, not yours.
Putting artificial limits on themselves.
Yeah, exactly.
And I am trying to stay active, right? And
Do you like the hike?
hiking is good. Yeah, I guess. Well, anyway, when I gave you the smartness answer, and one of the things that I brought up is that, you know, also the advice that I've gotten from different healthcare professionals is different sometimes, and so then it becomes hard to know who to listen to, right? Because you know, when I first started really having this problem. Well, of course, I waited a while, so then it just like becomes chronic.
Right, it gets
problem.
worse.
It was going to be chronic anyway, but you know, you go to the doctor and you say, well, how can I do so that this will go away? And the doctor's like, this isn't going away. My answer for you is you just can't do these things anymore. Like I used to run all the time. Now I can't run anymore. And I'm like, is this your answer for me?
Yeah.
And that is the answer,
Yeah,
right?
that's the-
And the physical therapist, when you go to PT, she's like, when you're doing these exercises to rehabilitate yourself, I don't want you to ever allow yourself to have any joint pain at all. And I'm like, well, okay, that means I can't move. I can't go up the stairs. What are you saying? Like
Yeah.
I can't, because I never am without pain all the way,
Mm-hmm.
right? And then, you know, you look at professional athletes. I'm not one, right? But they
None of us
say
are.
if you can't play without pain, then you can't play. So they're like, no, you're going to have pain all the time.
Yep.
And then, you know, I talked to another trainer and I was telling him my issues and he's like, well, you should expect to have pain in your knees as you're building up the muscles around this joint. You have to, and that's really true. You have to build up the muscles around this joint to strengthen it because your joint's not doing the job, right?
Right.
So you have to be strong around your joint, but you should expect some pain and inflammation. Well, that's the exact opposite of what my
What the,
PT
like,
person
yeah.
said. She's like, no,
Yep.
you're not allowed to have any pain.
Yeah.
Any inflammation. If you feel any pain, that means you have to stop right now. And I'm
Mm-hmm.
like, well, what the hell? What the conclusion that I've come to, and your answer was, each of these people has a different goal for you, right?
You got to know where they're coming from.
Got to know where they're coming from, and I really like that answer, and you can elaborate that on camera if you want to. But
Meh.
the conclusion that I came to, and I was already doing it, was like I just have to listen to my body, right?
Bingo.
What do I want, and listen to my own body and respect the cues that my body is giving me, but continue to engage my body. Don't completely withdraw.
Right, and because it's the kind of thing. I mean, to put it in perspective, like today, I'm sore as all get out, man. I did chest and back on Tuesday. It was after my week off,
Yeah.
so I'm sore. What all do I have? I have some tendonitis in my right knee.
Oh.
My ankle kind of comes and goes. My foot's kind of in a little bit, that sort of thing. I think it was from the jump squats, and then I'm tied up in my trap over here. I did cleans yesterday, so I've got some tightness up here, and it's sore. It hurts to move and stuff. There's never really any time where I'm kind of 100% ready to go and be in the gym. Some of it's learning to distinguish different types of pain. Whether it's simply just kind of muscle fatigue, pain, that kind of thing, or whether your body's really trying to tell you something. And some of that goes into it. Definitely definitely you always throw out the professional athlete advice whenever they talk about what they do, no matter what, just because it's so...
They're just beating themselves to a pulp.
They really are. They go out because they're being paid millions of dollars to be the very best. They will do whatever it takes to go out there. They'll play through anything. There was a hockey player in Game 6 of the finals. He ended up actually playing with, I can't remember if it was a punctured lung or if it was... I don't think it was a punctured lung. I think it was... I know he had a broken rib. Maybe it was. It was something like that. But these guys are crazy, right? So we don't worry about that. We're gonna stay healthy for the long run because we see the retired football players, the retired running backs. Their knees are shot, man.
Yeah.
I mean, so we don't want to be like that.
No.
And so we just we want to ignore that. But it's definitely, anytime people are getting advice from these different professionals, try to understand where they're coming from. What does it mean for them to have said they did their job? For a doctor, it's that you never have to come back with more issues, which means if you don't do anything that aggravates the problem, you're not going to need to come back and see a specialist on it, right? So then he's done his job. A trainer is going to say, well, we need you to get these exercises done so you can get to this fitness level, to this strength level. He doesn't think about managing your pain. He's thinking about getting you to this physical point. And so we got to do these exercises, do what you got to do to make it happen, that kind of thing. And so these people all have their different goals and their different objectives, and it really is a matter of try to balance what you want to be able to do with what your body will let you. Try to strike the best balance that you can between those.
Right. Yeah. So you have to know what you want. But yeah, what I want though is to be like super, is that really what I want? I would like to be super fit.